Hey, how's it going? I'm Mark. There is annoying lawn cutting noises in the background. I apologize. But if you can hear me, I'll check at the end to make sure you can hear me. This is my video about seeking mental health care and doing that as a young adult. So somebody who you might be right out of college, or you might not have gone to college, or you might just be any type of human being of the ages 20 to 30 or any age. But for some reason, you are interested in seeking out like mental health help. You have some kind of issue that you've been working through, or some patterns or behaviors or things that you're just not able to shake too easily, and you are interested in seeking out therapy for them. It seems like it might be a good fit. But you might still be wondering, what exactly is therapy besides sort of this image I have of it? What actually happens in therapy? What kind of situations are helpful for seeking therapy, or what do I need to know to be able to afford therapy? Am I even somebody who therapy is good for? Maybe I'm not a good fit. Maybe it's not for me. So these are things that I've said, and I've heard friends say, and other people espouse. And really, just to put it simply, therapy won't fix the world, but there is something inherently transformative and helpful about being present to somebody who isn't directly related to your life, but you're making part of your life in this certain way. And I think it can really help people a lot. I'm somebody who I had struggles growing up, and life struggles, mental health struggles, was in and out of different types of care, and I kind of set it aside when I was more of a late teenager, early adult. I didn't want to deal with things that way, and it kind of worked. But by the time I was, in the workforce, a little older, I realized that I wasn't really making progress on these things, and maybe some of the stigma I'd attached to mental health was getting in the way of really just facing some of these issues with some help. And so with knowledge of that, and also with knowledge of how hard it was when I started, it was really hard not to get trapped into a provider who wasn't a good fit, or things I couldn't afford, or struggles about money, and it was difficult. And in those difficulties, I feel like I have learned a couple things, and I really just want to share them with you in the hopes that it might help you go through this process for yourself. So I'm not making any assumptions here in terms of, some people are very lucky, and with the family coverage and with new, Affordable Care Act provisions, you can stay in your plan till you're 26, or your parents' plan, right? But that might not apply to you. It didn't really apply to me. My parents are divorced, and I fought really hard. My dad actually did create a new plan that he wanted to put me on, and he did, but it didn't have any mental health coverage, which we didn't realize, and even that was a huge protracted struggle. So when you hear, you're set till you're 26, or if you hear things like that, it might be a little more complicated. You might have to really be proactive, and when you find a therapist, think about cost. And so I want to explain to you that, first of all, there are a lot of options. So you have the traditional find a therapist in private practice, and you might use a tool like the Therapist Finder on Psychology Today. That's one way to find a private practice, meaning somebody who works just for themselves, and they have an office, and you go see them. But I would urge you to look into other more cost-friendly options. There's counseling centers, community centers. If you're at all affiliated with a college or university, or even if there's one just geographically near you, those are great places to start, because they take a lot of people through, and they spit out people to referrals as well. And they also might have some ideas about, this is a big one, about sliding scale fee therapists, meaning you can pay what you can. There's a huge difference in the cost you might pay for a therapist. In Minneapolis in 2011, 2012, I paid for a therapist that cost $60. I paid for one that cost $165. And for a while, I was spending close to 50% of my gross income on therapy. Now, I thought this was helpful for me because I finally found someone I thought I connected with, and I knew I needed to make progress. I knew I needed to get somewhere else than where I was. But I wish somebody had come in and said that if you don't set up therapy in a way that's congruent with your life, that's convenient, that's a place you can get to easily, and a place that a person that you really click with, and not just click with, but you have a good therapeutic alliance, meaning that it's professional, that they show really strong compassion and empathy, and also good boundaries, which this therapist kind of didn't. That is really important. And in fact, when you look into therapists, one thing to keep in mind is that research has shown that more than the type of therapy, so more than it being things like CBT or psychodynamic or what have you, more than that, the actual relationship is the most important part for outcomes. So you do better if you trust your therapist and you get along well with them. And that means that you have to actually be fairly proactive in choosing somebody that really works for you. So okay, let's say that you've looked at your insurance options. You've seen that you can't get coverage for your family, so you've looked around, and you can use the Psychology Today Therapist Finder tool to find sliding scale as well. And you can search, you can Google for this. Really, you just want to try something, or you can go into a counseling center. But you found somebody who seems like a good fit financially. It's maybe $50 out of pocket. You can afford it once every other week. It's still a big expense, but you're budgeting for it. Let's say you're going this way. When you actually meet the therapist, what should you expect, or how should you evaluate how helpful they are? Okay, so a good therapist will show you that they're engaged, will be compassionate, will not will maybe be down to earth, and you can have a preference here in terms of how much they disclose, how forthright they are about their own lives. I know that for some people, they're really uncomfortable with the kind of sterile doctor who's going to heal you. So maybe that's not you. And I also know that there are people that want a more explicit social justice emphasis. They want somebody who can talk about why it's hard to be a woman in this society, or why it's hard to be a trans person, or being gay, lesbian, bisexual, queer, gender nonconforming, asexual, any sexuality, gender presentation issues. And some people will be really skilled in working with that. Some people will make it an issue and or will foreground their identity and helping you get there. And some people will be actually very professional, will not reveal much, but you can trust them, and you know that they're very good, and it's almost like a craft for them. So really, regardless of where they fall on the spectrum of sort of disclosure, what you want is someone who seems committed to taking it seriously, is professional, definitely doesn't introduce things like their stress or their exhaustion or their frustration with the business or therapy from their perspective. I had a therapist that did this, and I found that as somebody who has sort of anxiety and attachment issues, I ended up really, without realizing it, wanting to please them, or wanting to make it feel like this was a fun time or this was a good time. And so I was kind of performing my best self, and that does not help me with some of the things I'm working on. So it took me until I found somebody who seemed like he was a little bit maybe too traditional. He had a very high degree. He was very well educated, and he was a white cis male who was straight and wanted to talk about this and that. But it kind of worked because he's a really nice guy, and I could trust his approach. I mean, there's a logic to it. And he also constantly affirmed that he was thinking about what I was going through. He would remember things and echo things back. And that to me meant that he was doing the intellectual work to kind of work with me. So those are all signs. So let me just kind of summarize. They're professional. They're your right level of disclosure. They make you feel comfortable in terms of identity. And that they show really good boundaries, especially with their role in sort of the business of therapy. There's no reason to introduce that. So they show you these boundaries, they show you these skills, and you step into their office, their world. And so what happens? So there are different modalities of therapy. So you maybe heard things like CBT, psychodynamic, I think I talked about earlier. Again, I think it really helps just to kind of go for something, but just so you know what these terms mean, generally speaking, CBT cognitive behavioral therapy is a skill-based therapy, and the kind of the point of it is to help you contest your automatic negative thoughts and to see how your thoughts relate to your behaviors and relate to your feelings. There's the CBT triangle. Yeah, and so it's very much about skills and it's very practical. So that might appeal to you. That's one kind of sort of world of therapy. There's also something more like psychodynamic, where you're working through, it's in a more sort of free form. It's born of some of the more like Freudian, like, oh, tell me about your thoughts of your dreams of your father or whatever. But it's more level-headed in it. But it's basically exploring how you came to feel these different things, or your sort of values, and sort of understanding how your mind is sort of set up. So that's, if you're someone, for me, who's very language-based and likes to explore and think about things, and isn't always as patient with skill-based learning, that might be a good fit. So that's psychodynamic. Mindfulness is huge right now. Self-acceptance. So mindfulness is basically learning how to watch what's happening in your body. And self-acceptance is learning how to say, this is what I am, this is what's going on, and I fully, compassionately accept it. There are things that I might change, but what's really important for me is to recognize, this is me, this is what's going on. And those two trends, mindfulness and then its application and self-acceptance, are really huge right now. They interact with everything, and they might be very helpful for you. So these are terms that are out there. Just start to kind of brainstorm and think about these, and try to sort of, you don't have to decide everything before you go. Again, I really say that please just try. Just show up. Just try someone out. See what the relationship is like. Make sure it fits for you. And have at least a little, maybe some questions or some ideas about, this is something that I want to work with. And don't be too tied to any one. You don't need to be super tied to any one approach. But they're out there, and you might ask, okay, I want to learn skills, or I want to really explore this thing from childhood, or I had this trauma, or this thing happened to me and I need to make sense of it. So I hope this gives you some sense of the landscape of therapy, some options out there. You don't need to be in therapy forever. Saying that you're seeking out therapy doesn't mean you need to, that you're committing to therapy for the rest of your life. There is brief therapy, especially in a counseling center. It's based around the quickest interactions, not the quickest interactions possible. An efficient sort of short-term therapy is quite common, okay? But, it does help in different points in time. So maybe you want to establish a relationship where you see someone once a month or once every other week, and you want to keep that going while you get set up in this new job or in this new part of the country, or while you deal with homelessness, or while you deal with uncertainty or precariousness in your life. And finally, I just wanted to address that, I feel like there are some real big reasons to be critical of the mental health system, especially things like psychiatry. And I'll probably talk more about this in other videos, but for myself, being part of the pediatric bipolar boom of diagnoses, I was really angry and really, I feel like, let down by the way in which we over-medicate and also just over-pathologize the experiences of young people, especially young people who go through abuse and trauma, that we shuffle them towards a diagnosis and don't try to help people develop a relationship with these things. And I just wanted to say that there are issues with medication. There are issues with this system and the inequality and social control through therapy and medication, especially medication. But that doesn't mean that you, as a person, can't benefit from doing that deliberate work with somebody else, where you have an alliance, you're working towards things. And I really do think that for many people, it is super, super helpful. And even this is my most recent therapist, somebody who I really trust, somebody who has this education, who's this guy is part of the system. He admits that there's a lot of bullshit out there. He is very forthright about it, and he knows that it's been hard for me to come back to this system after what I've seen, what I've been through. But on top of that all, there is something about this therapeutic relationship that has been helpful. So some resources for you. One other little thing is that I'm very happy you're watching this video. Be careful out there about all of the stuff you can consume online. So when I came back to therapy, when I was about 22 or 23 a couple of years ago, I was looking up a lot online, but a lot of the stuff I was doing online was trying to diagnose myself and trying to see what I was. Am I this? Am I that? I'm most things. I'm everything. But I would say that that if you can, try to prepare yourself to get in that therapy office, to get that first meeting, and don't worry too much about figuring out who you are and all this information beforehand, because that can be sort of its own little cycle of hypochondria, overthinking, or anxiety. And it's really good to build community around this. So I really hope to use this as a way to connect to other young people who are trying their best and doing their best through this difficult, precarious time in life and in the economy and your personal mental health struggles. Because the more open I find that I am about it and the more I connect about it, the more I feel like these issues can actually translate into the life I want to be living and the relationships I want to have. So I hope this gives you something to go off of, and I hope to make a few more things in this vein, and feel free to ask me any questions. Good luck out there. Yeah, all right, thank you for watching.